Hi, my name is Jennifer Matucha, and I am an embryologist at Ovation Fertility in Carmel, Indiana. The aim of my project was to determine if conventional insemination, or ICSI, led to a higher incidence in embryo mosaicism in IVF cycles with PGT-A. So this was important to us at our clinic due to an increased use of conventional insemination. And as PGT-A is constantly improving and giving this genetic diagnosis now of mosaicism, we want to be constantly proactive in our lab to determine if we're doing anything to increase mosaicism and decrease the number of embryos for patients to transfer. So this was a retrospective chart review between July 2018 and October 2020. A total of 2,672 embryos were biopsied, and all those samples were sent to Ovation Genetics for testing. So we compared euploidy, aneuploidy, and mosaicism between insemination types, and we also looked at fertilization, day 3, and blast development and FET outcomes. So when we compare mosaicism between the two insemination groups, we did not see a significant difference. Both ended up being about 11%. But surprisingly, we did see that there was a higher percentage of euploidy in our IVF embryos compared to ICSI. And also, when we divided our data and separated it by age groups, we saw this higher euploidy in IVF embryos in patients 38 and older. So this increased aneuploidy and ICSID embryos could possibly be from the procedure itself, or that we're helping abnormal oocytes fertilize, especially in these patients 38 and older. Next, when we looked at FET outcomes, we did not see any significant differences between either insemination methods for pregnancy. However, the one area of the study where we did see a difference in mosaicism was when we focused on ICSID embryos and compared testicular samples to oligospermic samples. We did see a significant difference, and this was 17 versus 9%. Possible explanations for this could be damaged sperm or damaged centrosomes, immature sperm from the testicular sperm. But this part of the study was limited due to those low cycle numbers for these specific groups, as well as other factors, so these results should be investigated further. Now, overall, the risk of aneuploidy in these ICSI cycles may suggest the use of ICSI, especially for just only male factor infertility, but overall, it does provide that reassurance that increased use of conventional insemination will not lead to a higher incidence of mosaicism. Thank you.